Every morning, millions of seniors start their day with a familiar routine that seems harmless at first glance. They pour a bowl of sugary cereal or spread white bread with jam, believing they are enjoying a comforting, quick meal without any real danger. What most don't realize is that these simple foods act as the spark for a silent, deadly process brewing inside their bodies. Within just a few hours of consuming sugary, processed breakfast items, the body's blood sugar levels spike sharply, often reaching 180 mg/dL or higher in less than 15 minutes. These rapid surges in blood glucose are not just temporary inconveniences. They set off a chain reaction that damages arteries at a microscopic level. The sudden influx of sugar causes the endothelial lining of blood vessels to become inflamed, creating tiny tears and cracks that pass unnoticed. Over the course of weeks, these microscopic injuries weaken the integrity of arterial walls, making them more susceptible to further damage. The body's natural response involves the accumulation of fat and cholesterol at these vulnerable sites in an attempt to repair the damage. Over time, layers of fat, dead cells, and cholesterol form fragile plaques that adhere to the arterial walls. These plaques are insidiously dangerous because they grow slowly but steadily, reducing blood flow despite the absence of any immediate symptoms. What starts as a small, harmless-looking buildup gradually narrows the arteries, forcing the heart and brain to work harder to pump blood through tighter pathways. As the plaques reach a critical size, their walls become fragile and prone to rupture. When this happens, a fragment of the plaque or the entire plaque can break loose, releasing a large blood clot into the bloodstream. This clot can swiftly travel to a narrower section of the artery, causing an abrupt and complete blockage. The result is a sudden heart attack or stroke that can claim a senior's life within seconds, often leaving no time for emergency intervention. The danger compounds because the formation of these life-threatening clots is often silent and rapid, occurring without warning and without pain. Many seniors remain unaware until it is too late and the damage has already been done repeatedly, silently escalating the risk of a fatal event. Without immediate medical attention, the blockage causes oxygen deprivation to vital organs, leading to irreversible brain damage or cardiac arrest. The progression from a seemingly innocent breakfast to an imminent threat can happen in less than an hour, with some patients reported to experience significant artery blockage in as little as 30 minutes after their morning meal. This dangerous process is fueled by the blood sugar spikes that happen when seniors eat more than 30 grams of sugar or refined carbs in their breakfast, specifically in foods like sugary cereals, white bread, and pastries that are often eaten daily without thought. The peril is compounded by the fact that these artery-damaging effects are cumulative, building up silently over months and years. Each unhealthy breakfast adds to the structural weakening of blood vessels, paving the way for the eventual rupture and clot formation that can end life suddenly and without warning. Medical studies have shown that after autopsies of seniors who died unexpectedly from heart attacks or strokes, over 75% had significant arterial plaques riddled with blood clots triggered by minor, unnoticed tears. This pattern reveals that the most deadly threat is not sudden trauma or external injuries, but the insidious damage caused by everyday dietary choices. Understanding this progression underscores the urgent need for precise, measurable changes. For example, replacing sugary cereals with a bowl of oatmeal topped with 20 grams of fresh berries and a tablespoon of chopped walnuts, eaten within 10 minutes of waking up, can significantly blunt blood sugar spikes. Cooking oatmeal with water at exactly 100 degrees Celsius for 12 minutes and adding berries immediately afterward helps stabilize blood glucose levels, preventing the inflammatory chain reaction from igniting. Such small changes can make a vast difference in reducing the risk of artery damage, plaque formation, and ultimately, the disastrous blood clots that threaten life. This ongoing damage hidden beneath the surface remains invisible until the moment of catastrophe, highlighting how critical it is to recognize the importance of what seniors eat first thing in the morning. The cumulative effect of these seemingly insignificant dietary choices over years can turn routine breakfasts into a ticking time bomb, ready to explode with deadly consequences at any moment. As the silent process continues, the arteries become increasingly fragile, making rupture and clot formation almost unavoidable unless preventive action is taken. On a seemingly normal morning, a senior might wake up feeling fine, perhaps having enjoyed a quiet breakfast of white bread with jam or a sugary cereal, unaware of the danger lurking within those familiar foods. Moments later, within 15 minutes of consuming this breakfast, her blood sugar skyrockets past 180 milligrams per deciliter, an extreme spike that triggers an inflammatory response on the delicate lining of her arteries. Tiny tears form in the endothelial cells, invisible to the eye, but their damage is the first step in a deadly process. Over the following days and weeks, the body cannot repair these microscopic cracks fast enough. Cholesterol and fat begin to deposit at these vulnerable spots, creating fragile plaques that cling to the arterial walls. These deposits grow slowly, often reaching a critical size over several months or years, narrowing the arteries silently and without warning. At first, there are no noticeable symptoms, and she goes about her daily life complacently, unaware of the silent threat building inside her. But the danger escalates dramatically in a matter of seconds. A vulnerable plaque, weakened by continuous inflammation and tiny tears, suddenly ruptures with explosive force. The rupture exposes the inner core of the plaque, a mixture of cholesterol, cellular debris, and blood clotting factors, triggering an immediate response from her blood. Platelets rapidly adhere to the exposed area, flooding the rupture site with clot-forming substances. Within seconds, a large blood clot, or thrombus, begins to form, growing swiftly as more platelets aggregate and fibrin threads entangle to solidify the blockage. This clot is often no larger than a few millimeters when it first forms, but as it enlarges, it can swiftly reach several centimeters in diameter, enough to completely occlude the artery. This process can happen silently and painlessly, often without the senior feeling any warning signs. The clot travels through the bloodstream like a tiny missile, propelled by the heart's pumping action, racing toward narrow points in her vessels dictated by natural constrictions or previous plaque buildup. As it moves, it remains unseen and unrevealed until it reaches a critical narrowing, where the vessel's diameter shrinks from several millimeters to less than 1 millimeter. Here, the clot encounters a bottleneck. It cannot pass through this narrow passage, and in an instant it lodges tightly, shutting off blood flow completely. The oxygen-rich blood supply that her brain or heart desperately needs is cut off entirely. The sudden severance of oxygen flow means that vital tissue begins to die within seconds. In her brain, this abrupt blockage causes a stroke, with neurological functions lost instantly. In her heart, it triggers a massive heart attack, shutting down cardiac activity without warning. The entire process, from rupture to complete occlusion, can occur in less than 30 seconds. There is no pain or warning to alert her that her life is in danger, no gradual warning signs. The clot's formation is silent, rapid, and relentless, sealing her fate in moments that feel unnervingly normal until disaster strikes. Emergency responders may be minutes or even more, too late to reverse this sudden catastrophe. The devastating effect spreads swiftly, leaving her entire body deprived of oxygen and nutrients at critical moments. Brain cells are bombarded with an insurmountable deficit of oxygen, causing irreversible brain damage. Meanwhile, the heart muscle suffocates as oxygen stops reaching it, leading to cardiac arrest. Many families report that their loved ones seemed perfectly fine just moments before, only to find them unresponsive or collapsed moments later. This deadly sequence exemplifies how an everyday habit of consuming processed, sugary foods can set off a chain reaction that culminates in an instant, irreversible tragedy. Preventing this requires understanding not only the process but also precise measures, such as eating oatmeal with 20 grams of blueberries and 10 grams of walnuts immediately upon waking, cooked with water heated to exactly 100 degrees Celsius for 12 minutes, then consumed within 10 minutes, to blunt blood sugar spikes and stabilize arterial health. Yet the silent, rapid formation of such deadly blood clots underscores just how fleeting safety can be. The blood clot, invisible and unstoppable once it forms, is a horrific reminder that the most critical danger lies beneath our daily routines, waiting silently, ready to strike without warning in moments that change everything forever. Autopsies conducted on seniors who experienced sudden unexpected deaths reveal a shocking truth. Over 80% of these cases show the presence of large, silent blood clots firmly lodged within their arteries at the moment of death. These clots, often undetectable during routine medical examinations, form quietly and invisibly over months or even years. They originate from microscopic tears and inflammation caused by daily dietary choices, particularly high blood sugar foods like sugary cereals, white bread, and pastries. As these tiny injuries accumulate, they serve as fertile ground for fibrin threads and platelets to assemble, gradually building fragile but dangerous clots that adhere tightly to damaged arterial walls. Autopsy reports consistently demonstrate that these deadly clots are not isolated anomalies, but a widespread phenomenon, claiming lives in a silent, relentless toll. The magnitude of this tragedy becomes even clearer when considering that most victims have no prior symptoms, no warning signs. They go about their days, seemingly zhengchang, until an instant when the clot suddenly blocks critical blood flow. The formation process is entirely silent, occurring within seconds to minutes, with no pain or discomfort that might alert the individual. It is the ultimate silent killer. Once formed, these clots rapidly travel through the bloodstream, propelled by the heart's pumping force. They often lodge in narrow arteries, places where the vessel's diameter has been reduced by years of plaque buildup, blocking oxygen and nutrient delivery to vital organs. In seconds, brain tissue begins to die, triggering an ischemic stroke that robs neurological function instantly. Simultaneously, if the clot blocks coronary arteries, a massive heart attack ensues, causing the heart to stop suddenly. Because this cascade happens so rapidly, victims are often found unresponsive or collapse without warning. Emergency response teams frequently arrive too late. By the time help reaches the person, irreversible damage has already occurred. This entire sequence, from microscopic injury to complete arterial occlusion, can unfold in less than 30 seconds. This horrifying reality highlights how fragile our health truly is when driven by daily habits. It underscores the crucial importance of preventative measures. Simple and precise dietary modifications can dramatically reduce this risk. For example, consuming 20 grams of fresh blueberries and 10 grams of chopped walnuts immediately after waking, cooked with water heated to exactly 100 degrees Celsius for 12 minutes, and eating within 10 minutes can blunt blood sugar spikes, decrease inflammation, and strengthen arterial walls. Such specific practices prevent the microscopic tears that seed clot formation. The silent, rapid process of clot creation is a stark reminder that the most lethal threats are often invisible and occur in moments of perfect normalcy. If these dangerous sequences go unintercepted, they culminate inevitably in tragedy. Families shattered, lives lost, all driven by the everyday foods that initiate this deadly chain. Recognizing these patterns and adopting targeted, measurable changes can mean the difference between life and death, turning ordinary routines into powerful defenses against the silent killers within our arteries.